Good morning, everyone, and welcome to our Friday special event series here at OLLI at Berkeley. Today's speaker is Bob Enteen, and he will be giving a talk called Our Pandemic Future. Bob will take questions at the end of the hour. At that point, you can raise your virtual hand or you can type questions into chat and he'll get them that way. Before we get started, I do have a couple of other events to let you know about. Next Monday, Dan Kamen will be speaking, and it'll be called What is the Just Transition? Climate Science, SCOTUS Rulings, and the Fight for Justice. So check us out on Monday for that. And next Friday, we have a town hall hosted by Darren Zook with Arlie Hochschild and David Hollinger about the elections 2022, referendum or reckoning. But on to today's show. For 7 years, Bob Enteen hosted a medical talk show broadcast by NPR, university, and community radio stations. His work in radio was based on 25 years in health research and policy analysis on acute and chronic diseases and disability. He has presented at meetings convened by the Brookings Institution, Yale, Columbia, and UC Berkeley. Welcome, Bob. Take it away.
Matt, thank you very much. Let me first thank Susan Hoffman, Matt Shears, and Maximilian Godino for providing this opportunity for me, and thank those of you who are viewing this program for your interest. Before I get into the meat of the presentation, I'd just like to review very briefly what we've been addressing for the past nearly 3 years now, COVID-19. As of today, according to the Johns Hopkins website, there are 6.6 million deaths from COVID. In fact, people who are knowledgeable argue that that's a gross underestimate. It's probably 3 times that, so 18 million estimated deaths. Over 600 million people sickened or disabled. 100 million or more of them will likely have long COVID. They'll be dealing with the debilitating effects of COVID for months, if not years. 7.5 billion people have had their lives disrupted. I assume that everyone attending this event has in some way had to change their routines, and some of you may have experienced horrific problems as a result of COVID. And estimated cost of the pandemic is up to $36 trillion. So this is a massive impact. Now, what I'm going to focus on is the future. What is the likelihood that we will experience additional pandemics? The world was unprepared for COVID. What my key messages are these: unless our national and global defenses are improved, the data suggests that it is virtually certain that we or our children and grandchildren will confront future pandemics. Some of these may be far deadlier and more destructive than COVID, both in terms of social effect and economic consequences, as well as medical consequences. And there are things that can and should be done to minimize our risk. When COVID occurred, I began to focus on the likelihood of future pandemics. If that could happen, what about the future? And I came up with a number of surprising discoveries, and my concern is to communicate those to as many people as possible. In today's presentation, I'll talk about pre-COVID warnings that an event like COVID was going to occur, why pandemics occur, predictive factors, what are the indicators that there may be an outbreak and then spreading of that disease, where most outbreaks occur, what regions of the world, weaknesses in our current defenses. Our defense systems, both nationally and globally, permitted COVID to occur, and unless changes take place, why would they not permit yet other diseases to arise, why global disease spread is inevitable unless these changes are made. I will critique the current pandemic treaty negotiations, and I will have a series of recommendations. Now, I mentioned that at the outset of COVID, I began to explore the field and try to understand better what pandemics involve. And I discovered that exactly 30 years ago, in October 1992, 19 of the world's leading scientists convened at the Rockefeller University in New York City, and they published this book, Emerging Infections. It's the conclusions of 18 months of study concerning the potential effects, the potential occurrence and effects of infectious diseases worldwide. This was prompted by the fact that AIDS had occurred for many years during the 20th century, the 1930s through the 1970s. Infectious disease specialists thought it was a golden age of antibiotics and that they would become outmoded. Medicine had made such terrific progress that the expectation was that we didn't have to worry about many diseases any longer. What the 19 scientists at this meeting realized were that infectious diseases are an existential threat. Unless our defenses are strengthened, future pandemics are inevitable. We are all vulnerable. No one is remote. If you think about the fact that two of our presidents, Trump and Biden, have both come down with COVID, these are among the most protected people on earth, and yet even they were not safe from the disease. So it matters not how far you are from the origin of an outbreak, how wealthy you are, how powerful, how celebrated. You are vulnerable, and the people you care most about are vulnerable. And complacency is a deadly phenomenon. If we begin to feel that we are in control again, we may slacken our vigilance and we'll see a resurgence of this kind of difficulty. Now, let's see, here we go. I discovered in the course of my research that the report by the 19 scientists was not the only one that has been produced. I now have a collection of over 2,000 articles, books, expert commission reports, virtually all of which make the same assertion that these diseases are a threat. These have been published continuously from 1992 to the present day. And here is one that appeared in Nature Medicine. Nature is one of the world's most prestigious science journals. And even in July of 2022, there was an editorial to the effect, we're sleepwalking into the next pandemic. So we have, here, let me go back. We have at the outset failed communications. Despite 28 years of continuous urgent warnings by some of the world's leading scientists, not one of the planet's 204 countries and territories was prepared in 2019 when COVID struck. So something is preventing those many scientists' warnings from reaching the public. Another problem that we confront, failed international defenses. This chart was produced at the University of Oxford, and it depicts in simplified terms the international network of organizations that share responsibility for controlling infectious diseases, preventing or responding to them. The red arrow points to the World Health Organization, which in principle is the central agency for this control effort. And if you consider what you're seeing in this chart, it's basically a patchwork of many organizations. Now, if you consider as well individual continents and countries, you have the same patchwork. Within the US, every one of our 50 states has a somewhat different system of public health and of reporting, differences in the forms that are used, the procedures they use, and this is true worldwide. So we've got a tremendous variety of systems, in effect a non-system, a non-network that is supposed to be defending us. I found out as well in my research that epidemics and pandemics are increasing dramatically in frequency. Here's another chart that depicts first 1981 with the emergence of HIV on the left. And as you move to the right toward 2022, you can see a growing number of epidemics and a few notable events, pandemics, ending there with COVID. So we see an increase in the number of infectious diseases. In the past 2 months, while preparing for this presentation, in expectation of this presentation, I tracked, I read the New York Times, the Washington Post, a few foreign newspapers and magazines. And in 2 months, I've identified just this list of infectious diseases and where the outbreaks have occurred. The ones in black are re-emergent, which means that these are diseases that we've known about previously and they're resurging. And I'll point out, for example, even polio in New York State. Down at the bottom, you see an emergent condition, Langia, in China. Emergent means that it's a new disease, one that we have never seen previously and know very little or nothing about. So we're seeing a tremendous increase in diseases. When you consider COVID in relation to some of these other diseases, you discover that it's not nearly as virulent. This chart shows the World Health Organization's most recent listing of priority diseases by case fatality rates. And if you look from COVID across to the right, roughly 1 to 2% of all people who come down with a confirmed case of COVID will die. Compare that to the case fatality rates for the other WHO diseases in this list. Some of them are 20, 30, or 40 times as deadly, have that much more of a case fatality rate. Now, I will qualify that and say that there are also considerations of transmissibility. Some of these other diseases may not be as transmissible as COVID is, but the fact remains that if transmissibility changes through mutation, some of them would have a far greater case fatality rate and perhaps equivalent transmissibility to COVID. Now, why do these diseases arise? The problem, I'm going to try to take this out. Yeah, okay. The problem is zoonotic disease. Zoonotic diseases, as the name suggests, the first part of that word, arise from the transmission or spillover of animal germs, animal pathogens to humans. And that can be either wildlife, for example, the circle to the left, or livestock to the right. To the extent that we interact with animals, we are at risk of a spillover of animal diseases into humans. Let's see. Oh, okay. Now, 60% of all human infectious diseases are zoonotic. They come from animals. And when you consider new, previously unknown infectious diseases, emergent diseases, 3 out of every 4 are zoonotic. Where at sea, we are in a huge pool of germs coming from other animals. We're at risk from a wide variety of animals. And the way spillover occurs, it starts when you've got the diseased animal, and if it infects a single person, that's the spillover. And then if that person is capable, for some biological reason, of transmitting that infection to other people, eventually you get an exponential increase in the number of people infected with what was originally an animal disease. And down here you can see that a plane carrying passengers, one or more of whom are infected, then begin to spread this worldwide. So that's the spillover and exponential increase in pandemic disease. Just a brief explanation or some definitions. You start with an animal reservoir. That's where you have no transmission to humans. It's simply an animal disease. Then you have an outbreak where there may be one or a few animal to human cases. And if it's a serious condition, or in the past has been a serious condition, then even a single case may represent an outbreak in a locality. An epidemic occurs when you have the spread of that disease from that one or few individuals, either regionally or through an entire nation. Then you have a pandemic, which is an international spread. That would be if the disease affects people in 2 or more countries. And finally, you have the example of COVID, a global pandemic, which means that every country on Earth is affected to some degree. Now, what factors predict zoonotic outbreaks? As I said, it's our contact with animals and animal pathogens. So anything, any factor that increases the frequency of human contact with infected animals or carrier animals, animals that aren't themselves diseased but transport the pathogen, or any factor that increases people's vulnerability to those pathogens, is a predictor for zoonotic outbreak. And this is a long list. I'm going to go through these step by step. In terms of where these predictors are most often found, where outbreaks occur most often, this is a global map. And if you focus on the central area, the tropical zone and the subtropics, this is what we need to concentrate on, because virtually every one of the predictive factors I'll be going through is more frequent, more problematic in the tropics and subtropics than anywhere else on Earth. Now, if you look at poverty, which is a kind of catch-all, poverty, you see that central section is a different set of colors from the remaining countries. If you look at poor sanitation, the share of people who are engaged in open defecation, which enhances or promotes the spread of infectious pathogens. If you look at unsafe water for drinking, bathing, or hand washing, again, that same tropics and subtropics. Poor general health of the population. Now, in some of these cases, the colors will be lighter than the surrounding area. So for life expectancy, again, it's that central area, in this case, particularly sub-Saharan Africa, where you have a particularly high, a great problem in terms of life expectancy, much shorter expectancy. Deaths from malnutrition, maternal deaths, infant mortality, child mortality, general burden of disease. In every instance, these indicators are more prevalent, more problematic in the tropics and subtropics. Urban, rural. People who live in rural areas are obviously more likely to encounter wild animals or farm or ranch animals. And then density of poor livestock keepers. Since we're talking about countries which are among the poorest countries on Earth, poorest people on Earth, they can't afford to maintain their livestock in the with the same degree of quality that we're used to in the West. And that photographs gives you a sense of what one of these areas might look like. In terms of bushmeat, hunting, butchering, and eating of wild game, more frequent, more common in the tropics and subtropics. Wet markets, use of wet markets, and these are bats and rats that are being served. either these or other equally exotic foods. Land use, very important. Our use of the land for deforestation, large-scale mining, agricultural intensification, and other purposes is producing habitat destruction. And if you destroy the habitat, animals need to migrate in order to find new food sources. And the likelihood is that they will migrate toward human settlements because that's where they will likely find new sources of food. And here again, a map showing that land use is particularly problematic in that same region of the globe. Current prevalence of virulent infectious diseases, this is where the outbreaks occur. And if you look at this, the borders of these maps, you'll see some of the same names that that appeared in that original list of high priority diseases. Virtually every one of the WHO diseases of greatest concern arises primarily or originally in the tropics and subtropics. Lack of medical resources and inability to control disease outbreaks. So the problem here is that not only are these diseases occurring in certain areas of the globe, but because of poverty and lack of resources, those areas are least equipped to control outbreaks and prevent their spread. Fewest doctors, nurses and midwives, hospital beds, or general epidemic preparedness. Climate change and global warming effects. Global warming is producing a massive human migration towards cities primarily. I'll get to that in a moment. And again, animal habitat destruction and migration. It's expected by the year 2050 that in the tropics and subtropics, there may be as many as 143 million climate migrants. And since again, most of these people are poor in the tropics and subtropics, when they migrate into cities, it will be into slums. And you can see that this is the region of the globe where you have the highest density of urban population already living in slums. Migration, what's the problem in terms of disease transmission? Rural migrants may be carrying pathogens due to contact with infected wildlife or livestock. If they're already infected, migrants may expose urban populations, their slum populations, to these diseases. The migrants may themselves be subject to diseases endemic to the slums, and over time, those people may interact with other people within their cities, some of whom will travel and infect others. Now, in terms of world population, if the key is the frequency of human contact with infected or carrier animals, then an increase in population, either of people or animals, will increase the likelihood of contact. And what we find when we look at demographic projections is that the three areas of the world we are most concerned about, sub-Saharan Africa, South Asia, and parts of Latin America, have nearly all of the expected population increase over the next 30 years. Of the nearly 2 billion additional people on Earth, by far the great majority of those people will be born in the tropics and subtropics into poor families. And once you have that high risk population or that infected population, it's going to go abroad because you've got a tremendous increase in air and sea traffic. And I can't see on my screen, but there's been a 400% increase in air traffic in the last several years. So a tremendous increase in the number of people who are moving from the tropics and subtropics, in between the tropics and subtropics in other countries. Now, why can't zoonotic pathogens be stopped at our borders, even if they're originating elsewhere? One reason is that there is natural migration. Birds fly, insects fly, fish, wild animals migrate. They don't respect national borders. In addition, you've got the increase due to habitat destruction. A second factor is rodent stowaways on ships. We've got huge cargo ships with thousands of containers, and some of those containers will have as stowaways rats and other rodents that are carrying diseases. You have asymptomatic, unwitting humans flying on these on planes or sailing around the world. You have black market human trafficking of people who may be infected, and you have a black market animal trade, people who are selling exotic animals throughout the world, and some of those animals may be infected. Now, what's wrong with our current defenses? In 2003, China was late in reporting SARS to the global community. And because of that, the World Health Organization upgraded, they strengthened their international health regulations and came out with a set of regulations in 2005. And the aim there was to require that signatory countries, at that time 195 signatory countries, will conduct surveillance efforts to spot an outbreak early, to report it, and to respond to it. The problem with this is that even though countries that signed on to the international health regulations are supposed to do these things, there's a tremendous degree of non-compliance and very weak sanctions for countries that don't comply. So at the top, we see China in relation to SARS in 2003, and then COVID in 2019. But the fact is that many, many countries, the US, Canada, UK, France, Germany, many countries have failed to comply with the IHR at various times. There have been studies done of weaknesses in the infectious disease defense systems of various countries. In 2017, a study looked at 47 African countries, and there was not a single country that had all of the required IHR capacities. In 2019, the World Health Organization did a similar study and found that the average score among 195 countries was 40 out of 100. So there's no country anywhere that's doing a really good job in controlling or surveilling infectious disease. Here's another problem, funding weakness. The dark blue bars that you see are the amounts that various countries have committed to fund pandemic prevention and control. And the light blue bars are, the light blue bars are what they've committed to, and the dark blue bars are how much they've actually contributed to date. So in effect, countries are indicating a preparedness to fund improved defenses, but they're not following through with funding. Here's another example. Most of the funding that has been provided has gone toward vaccines. And if you look down at the bottom, health systems and response, only a very small portion has gone into investing in the localities where infectious diseases most often originate. Political weaknesses within the current system. Consider, I won't go through these point by point, but consider what President Trump's actions were in relation to COVID, a whole list of things that stymied efforts to control the condition. Complacency. The photograph at the bottom of this screen shows you a portion of the UN General Assembly a few weeks ago during a high-level meeting on COVID hosted by the UN Secretary General. These are the back rows. There were people sitting closer up, but a year ago, these seats would have been full. And now there's a sense that COVID is diminishing, we're in control. President Biden has told us the pandemic is over, and there's a growing complacency. And if you remember that original report, the one from 1992, one of the concerns that those 19 scientists expressed was that people would slack off, they would cease to be vigilant, and you would have a recurrence or the emergence of a new disease. Other weaknesses. Currently, the World Health Organization, through the World Health Assembly, is conducting treaty negotiations. Initially, 27 countries applied to negotiate a treaty. Far more are now involved, but the problems with those negotiations are that they are projected to last for up to 4 years or more before a treaty is signed and implemented. And as we've seen, there are so many new diseases and the risk is so great that this is too long a period. Moreover, those negotiations have not as yet included country heads of state. And what you need is the ultimate decision makers in each country in order to come to the decision as a whole that we will work against infectious diseases. In addition, several countries have refused to accept legally mandated provisions. These countries include the US, China, and Russia. And their main reason for refusing to accept legal mandates is that they feel they would lose sovereignty. They want to retain the right to make decisions as they go along and not be legally obligated to follow a course decided upon by the global community. And this undermines adequate compliance. If you have weak sanctions, if you have countries who don't feel obligated to comply, then you may have the problem of rampant non-compliance, which we've seen thus far. What can and should be done locally and nationally? We need to demand within the US, we need to demand that Congress provide sufficient funding, not just commit to it, but actually provide the funding and move ahead rapidly with treaty negotiations, involve our head of state, President Biden, and accept legal mandates. We need to keep politics out of science and medicine. We can't have a leader like another Trump who is trying to replace Dr. Fauci and others at events and describing what they consider the appropriate science and medicine to be followed. We need improved scientific communication with the media. If you remember again, the 1992 report, and then that screen with all of the reports that I've identified over the years that provide the same warning. That message is not getting through. Scientists aren't taught to communicate with non-scientists, and non-scientists aren't reading scientific journals. So even though there have been hundreds of warnings, the general public and policymakers are not seeing those warnings. Arguably, the scientific community needs a good PR agency. We need to improve public education regarding mandates like masks and social distancing, and also the importance of vaccines. We need to simplify our national defenses. We can't have variation from one state to another and from one governor to another in terms of the policies they establish if an infectious disease were to strike. We need simplification and uniformity. We need to increase our focus in research on pandemic diseases, zoonotic pathogens. We need to improve our vaccine development and our stockpiling of these resources. We need to enhance medical curricula and continuing medical education so that physicians are better, and allied medical professionals are better informed regarding zoonotic diseases. We need to remain vigilant. We can't begin to feel that because we seem to be gaining control over COVID, everything is now fine and we're safe for the foreseeable or long-term future. And we need a groundswell of public support and demand. We see that in regard to nuclear proliferation and global warming, two existential threats. Pandemic disease is an existential threat, but there is no mass support at this point to protect ourselves against it. What can be done internationally? We need to concentrate efforts and resources in the tropics and subtropics. If you remember back to the chart on where the money is being spent, most of it currently is going toward vaccines. But my position is that we need to invest more heavily in surveillance and containment in the localities in the tropics and subtropics where these diseases originate, so that they don't spread and never reach a point when they go abroad. We need to speed treaty negotiations and include heads of state. It's just been decided recently that there will be a meeting of heads of state, but that'll be a year from now, much delayed, much too long before that has taken place. We need global governance and strong legally binding sanctions. As in the case of nuclear proliferation and global warming, we need to put aside our national differences and come together as a community of nations agreeing to collaborate and cooperate in this purpose, for this purpose. We need assured, adequate funding. We need sustained funding of this. We can't have funding drop away through complacency as we seem to be gaining control over one or another outbreak. We need equitable government funding. We need to train, equip, and maintain local surveillance and control teams. I think what we need to do is go into the tropics and subtropics, into small towns and villages where many of these conditions arise, find bright young people, train and equip them in the same way that in China they had barefoot doctors, train local people to improve surveillance measures so that when there is an outbreak, it's reported, treated, and controlled very quickly. We need to simplify our global defenses so that in the same way that we need uniformity and simplicity within our US defense systems, we need that globally. That map, you may recall the map of the University of Oxford depiction of the complexity of the current international defense system. That has to be changed. We should be using telemedicine, drone deliveries, and other latest technologies to reach the people who are affected at the origin, where the disease outbreaks occur. We need economic support for poor infected individuals. There are many instances in poor countries where people who come down with a major disease, a zoonotic disease, don't report their condition, because if they do, they'll have to quit work and they can't afford to stop working. So what we need to do is provide economic support for them so that they're willing to come forward, and their neighbors, their fellows within the community are willing to come forward and report a disease outbreak. We need, again, to remain vigilant, and we need to promote a groundswell of support among global publics. And where is our leader, the person who can produce a groundswell and develop a genuine international concern for this issue? Now, I've raced through these. I look forward to your questions and comments. If any of you feel that this is worthwhile, I would welcome learning about other speaking possibilities. I again want to thank the people at OLLI Berkeley. And for every chart that I've shown, there are dozens of additional charts. There's far more information available on this problem. And I will be publishing a low-cost ebook on Amazon by the end of the year. So if you have an interest in that, you'll be able to find that. And with that, I'm done speaking and would welcome taking your comments and questions. And let's see if I can get this off.
Thank you, Bob. You've given us quite a lot to think about. There is a question in the chat.
Sure.
Gregory asks, is the world and or the US doing anything right? In other words, do we have anything going for us?
Yeah, I think,
or not?
sure.
Go ahead.
I think the fact that there are treaty negotiations underway and that individual countries are beginning to look at their own defense systems are positive. The problem is that things are going too slowly. I will mention, by the way, that in the 3 or 4 years prior to COVID, there were only a few hundred articles in the medical literature concerning pandemics and the likelihood of pandemics. And now, since COVID, there have been something like 40,000 articles in the literature. So there's a tremendous increase in focus, but things are moving too slowly. And there is the risk of political intrusion and policymakers being deflected into other priorities as we seem to gain control over COVID.
Yeah, while we wait for another question here, Bob, I've been thinking about the political intrusion element here. If we're talking about having more effective surveillance, say in regions that are remote, what do we do with governments that are resistant and or that actively produce misinformation about this?
Yeah, it's a very big problem, and that's where sanctions come in. We need to build into the treaty negotiations strong sanctions, incentives and disincentives so that countries will comply with new regulations. And if there is a country which due to its leadership or violent factions within the country are serving as stumbling blocks, the global community needs to come up with answers either to keep those countries separated from the community or to go in with sufficient force that they can assure that what needs to be done will be done.
Thank you. It looks like Leonard, do you have your hand up? Would you like to ask a question? We'll unmute you. This is Leonard Levinson.
Yeah, thank you for the presentation there, Bob. I have a question. It seems to me that everything that you've covered would be best presented at the United Nations. And is there a way, have you thought about doing something like that?
Well, I would love to have the opportunity or through someone else who's a more effective spokesperson present on this matter at the UN. I'm sure that they've covered the issue to some degree because, as I showed in one of the slides, they do have meetings regarding COVID, and presumably that includes consideration for future pandemics. But more needs to happen. You saw the empty chairs at a recent meeting at the UN.
I would suggest that you contact Samantha Power and talk to her about your presentation and the likelihood of trying to get some roads into the UN.
Yeah, she worked with President Obama, if I remember correctly.
She did, and she also was a UN ambassador.
Yeah, and a good person.
Thank you.
Okay.
So we have a question from Chris. Thank you, Leonard. If a new pandemic hits the world, how prepared is the US and the rest of the continents to handle it? Have we learned anything? Have we gotten any better?
Currently, I'd say that we're no better prepared than we were when COVID struck. Right now, there's still a lot of talk and deliberation, but I don't know that we've strengthened our defense systems at all. I've seen articles recently to the effect that some programs involved with pandemic disease are having their funds cut instead of increased. We have people like President Biden saying that the pandemic is over, although there are still thousands of people around the world who are dying every day from the disease. So I think we're letting our guard down. This is complacency again, and we haven't seen great improvement. I look forward to a strong treaty with major sanctions that may make a difference. I hope so.
Thank you. So here's a follow-up. Valerie asks, are there particular countries which you think are doing the right thing, even if the broader kind of response is not enough?
Well, I think it's, without having specifics at hand, I would assume that the more developed countries have far greater resources, money, medical personnel, medical technology, surveillance systems, so that they're doing a somewhat better job. But consider again, in the US alone, we've had over 1 million deaths. And again, if you assume that the estimate is actually much greater, we may have had as many as 3 million people die in the past 3 years from COVID. So we're not doing very well. I should mention too that 3 million deaths in the US is nearly 3 times as great as the number of people who've died from every war the United States has been in, including the Revolutionary War and the Civil War. So we're not doing very well. And if the US isn't doing well, I suspect that most other countries are not.
So Anne would like to talk a little bit about treaties. You mentioned treaties. She wonders, does the US agree with the WHO treaty elements? Or do we just want to keep our options open right now?
There's general agreement, and we are participating actively. But again, it's the question of an unwillingness on the part of our government to sign on to a legally binding agreement. And as soon as you have that weakness, you undermine compliance with the overall agreement. So that's a very serious problem. And it's a dilemma. I understand that countries protect their sovereignty, but this is a case where we have to look beyond our national concerns, because we're all in this together. This is an existential threat that confronts every country, not just the US. And if a far more serious, more deadly pandemic arises, then sovereignty, national sovereignty won't be especially important. It'll be a competition for scarce resources among survivors.
So Anne responds, she was horrified to learn that the US is #1 in COVID deaths, followed by Brazil. Should we communicate this more broadly?
I think people are, to the extent that people follow this, I think people are aware of it, but I don't think they're focusing on future pandemics. I think everyone is focused, the media is certainly focused on COVID-19. And now with the sense that we're gaining control in this country, if not elsewhere. In Europe, they're having a resurgence, for example. So it's always COVID-19 and what's happening now. My concern again is, if that can happen, if COVID happened, is there a chance that some next pandemic, the next COVID can happen? And might that next pandemic be far more virulent than COVID?
So Barbara is asking a practical question here. Who in the US decides whether we'll comply with worldwide rules? This is a phenomenon we've seen for years with the US, right?
Well, it would be the administration and the Congress. Presumably the Congress would have to agree to this, and the president would have to be willing to sign on to such an agreement. I don't know if it would be Biden's signature or someone else's, but those are the people who make the decisions on our behalf. And that's why we need a groundswell of support, because right now we don't have the same kind of demand that we see internationally in regard to nuclear proliferation and global warming. We need that kind of support to guard against this existential threat.
So I have a bit of a speculative question for you.
Okay.
As I'm listening to your talk and thinking about what the future might look like, if COVID wasn't enough of an alarm to the worldwide community to unify and really have this kind of worldwide response, in your view, Bob, what kind of pandemic would send that message, and at what point would the world be able to come together and see that it was kind of one problem for everyone?
Well, if you think again about that list of other WHO high priority diseases, take the example of Ebola. When the Ebola outbreak first occurred and became public knowledge in the US, there was a terrific fear and an outpouring of concern, a lot of media attention. And then it died down because it was taking place elsewhere. And I should mention, by the way, that there have been several recurrences of Ebola. Right now, Uganda has an Ebola outbreak. So what we need to do is somehow communicate to people in very vivid terms that, in a sense, however horrific COVID has been, given the number of deaths, the social disruption, economic cost, there are other diseases that are far more dangerous, and under the right circumstances, we might be confronting those, and we might have a repeat of the experience of the 1918 flu, or worse. It's a communications issue. We have to get that message across, and people need to appreciate that they're at risk.
Yes, indeed. Let's see, we have one other question here, and then before I ask it, folks, if you're interested in saving the chat, you can do that by heading over to the three dots kind of at the bottom of the chat, clicking on that, and it'll give you the option to save it if you're interested in these questions. Barbara says, maybe you mentioned it and I missed it. Did she see that SARS appears mostly in North America? She wonders if you could talk a little more about SARS.
SARS originated in China, and my impression is that the largest prevalence of cases, the largest total number of cases, was in China, but I can't say that for certain. That's a fact that I don't have at hand at the moment.
Well, if we have no other questions, this is last call for you folks, OLLI members. Can we get a link to today's talk and presentation? Would like to be able to send it to others. We are going to make this available through our communications. So once it's been reviewed, Nancy will send it out, and you can send it along that way. But Bob, thank you for bringing this information to us today. Thank you for joining us. We wish you well with this presentation, and we hope that the alarm bell that you're ringing is heard by many people around the world. Thanks for joining us, everyone.
Thanks.